Okay, for the blue millionth time today, my name is Tiffany, and I've decided to start a video blog or video journal about my struggles with mental illness. I have multiple mental illnesses. I have borderline personality disorder. I also have Rapid Cycling Bipolar 1, and I have Generalized Anxiety Disorder. I was also diagnosed with post-traumatic stress disorder in the past, several years ago, and thankfully I can say that that is something I can now pretty much cross off my diagnosis list. I guess you would say I'm in remission. I rarely have symptoms anymore. And when I do, they're so few and far between that they really don't meet the criteria for diagnosis anymore. But anyways, I decided to start doing the video logs because, for one, I need to start journaling again. It's something I stopped doing a while back. I mean, I do it every now and again, but not every day like I'm supposed to. I stopped. One, I got bored. I get bored of everything. Everything in my entire life eventually becomes boring, and it usually doesn't take that long. And also, on top of that, I was feeling better. Anybody who suffers from mental illness, you go through these periods of time where you're feeling better, and you just think, I'm better. And you stop doing the things that made you feel better and helped, and then and that's what happened to me a couple days ago, for a couple days. So I decided that I was going to video log and see if maybe it would be more interesting, especially since I'm getting feedback from people. And I don't expect it to all be good, because we all know there are you morons out there who have no idea what you're talking about. You don't know anything about mental illness. You just want to judge, say it's all in our heads. Of course it's in my head. It's not in my ass. My ass doesn't make me crazy. It's in my head. But I'm hoping it'll hold my interest, and I'm also hoping to reach people somewhere out there in the YouTube universe who might be dealing with similar things that I'm dealing with, and maybe I'm at a place further than you in your recovery, and I can help you out, and maybe you're at a place further in your recovery than I am, and you can help me out. Also, I think that it just seems to me like it would be comforting to communicate with people who really understand what's going on in your head, because I have several supportive people in my life who've done the research. They know what's wrong with me. They kind of know why I say and do and think and feel the things that I do, but unless you feel it, you really can't understand it. So I think that would be nice. And you guys excuse me, because I'm gonna have to cough or sneeze or something. My throat itches. I'm so sorry. I have a cold, but I'm not redoing this video again. Anyways, so those are my reasons. That's what I'm doing. So let's talk about my mental illnesses. Bipolar, we'll start there. That's something most people have heard of. It's a pretty common term. Sometimes people use it as a joke, and that's fine. I can laugh at myself. I'm really good at laughing at other people. Anyways, bipolar is it's marked by distinct mood swings. Usually, people with bipolar tend to cycle in long terms, such as at least months. There's bipolar 1. You might start at a baseline where you feel normal and everything's okay, and then you become manic. And if you don't really know what that term means, it means amazing. You are amazing. You feel like you're amazing. Your life is amazing. Everything's amazing. You're excited. You have all this energy. You're so happy. It doesn't matter what. You're happy. Hi, Uncle Bob. It was his time. It's all good. Let's go party. And no, I'm not being insensitive. I don't think I've had an uncle die. But anyways, so mania is great, except that you tend to make very bad decisions when you're manic, because you're very impulsive, because basically you're high. There's no chemicals involved, and it's not illegal, but you feel like you're high. And people don't tend to make great decisions when they're high, so there's your downfall. Unfortunately, people who tend to stay more manic than depressed will choose not to seek help and not take medications because they enjoy it so much that they really can't wrap their head around the bad choices that they're making. And then the second part of bipolar 1 is depression. Sometimes patients crash right into it after being manic, and sometimes there's a normal period, the baseline, in between. And the depression, if you've never been some sort of extremely clinically depressed, you really can't grasp it. It's not like that, oh, I'm bored, or my girlfriend dumped me, or, you know, oh, life is crap. It's so much more extreme than that. It doesn't matter how nice your house is, and how wonderful your spouse is, and how great your kids are, and how wonderful your career is, or people all around you might envy you for this wonderful life that you have, but you don't feel like it, and you can't put your finger on it. You know nothing's wrong, but you feel like you're dying inside for no reason, and that's so hard to explain to people. But anyways, that's the second cycle. And I mentioned that I rapid cycle, and what that basically means is you put bipolar on fast forward, and that's me. For me, everybody's bipolar cycle is a little bit different. It's kind of like a woman's menstrual cycle. You know when it's probably going to come, you get signs, you get cramps, but you don't know what it's going to be like, and what you're going to need, and how you're going to take care of it. It's just, everybody's different. I usually know that I'm going into I start at baseline, and then I usually know when I'm going into a manic phase because I'll start losing sleep. And it's not that kind of sleep where you have so much on your mind that you can't sleep and then you're exhausted in the morning. I have what's called rapid thoughts, and it's a lot on your mind, but anyway, sometimes it's nothing. Your brain just moves 90 miles per hour and you don't need sleep. Then usually after a night or two of that, that's when you start getting that high feeling. And I actually remember telling my mom once, I was on the phone with her. I tend to make a lot of phone calls when I'm manic. I was like, give me Wonder Woman's jet. I know how to save the world. I can end world hunger. I can lower the crime rate, and you feel like you're invincible. And that's how I feel when I'm manic. Thankfully, at this point in my life, I've come to grip on some really good coping skills, and I don't tend to make too many bad decisions when I'm in that great happy manic phase, so that's always nice. But after that, I usually crash straight in. That lasts about 2 or 3 days, and then I crash into this phase that seems very aggressive, and I suppose it's due to the lack of sleep, because everybody's irritable when they haven't had enough sleep. So you take a crazy person and you deprive them of sleep for 3 or 4 days, 5 days. It's ugly. It's, don't talk to me, don't look at me, go away, just go away. And that lasts for a couple days until I finally go back to sleep, and then I get depressed, and that's all I want to do is sleep. I don't feel like doing anything. I don't want to go shopping. I don't want to cook. I definitely don't want to clean. I just want to sleep. I really have to force myself to function. So that's my bipolar cycle. After that, I go back to baseline and start all over again. Sometimes every 2 weeks, sometimes every 2 months. It's usually more often than I usually do it a couple times every 4 to 6 weeks. But that's my bipolar cycle. And then borderline personality disorder is marked by extreme mood swings, which can be similar to bipolar, and especially since I rapid cycle, sometimes I don't really guess what's going on with me. Well, not really guess. I've narrowed it down to a science over the past 2 years, but it wasn't easy. But anyways, intense mood swings. You'll be fine 1 minute and angry and screaming the next, and doing completely irrational things. Or you'll be fine 1 minute and crying the next. Or you'll be angry 1 minute and crying the next. Or you'll be crying 1 minute and happy the next. There's also this extremely irrational fear of abandonment, and you feel like everyone in your life is going to leave you, and it doesn't matter how good they've been to you and how much they latch on to you, how much they prove themselves to you, you still feel like they're going to leave, and sometimes you'll do horrible things because of that fear. Whether you be obsessive and clingy and annoying, or you sometimes you push people away, you do bad things and try to hurt them because you feel like, well, they're going to leave me, so I'd rather them leave me because of something I did, and not just because you want to give them that reason. Also, there's this sense of lost self. You don't really know who you are. Everything you want, feel like it changes so often that you're just lost. When I do my video on that specific topic, I'll have to show you guys pictures of myself from the past year, because it's insane how much I change. Everything I want, feel like, need changes all the time. So for me, those are the basics. When I get on those specific topics, we'll talk more about that. And then also there's the anxiety disorder, generalized anxiety disorder. Basically, it's generalized because it can mean different things for different people or different things for the same person. Sometimes noises make me nervous. Sometimes repetitive actions make me nervous. Repeating myself often makes me very, very, very nervous and irritated. Sometimes it's a social anxiety where I can't go places and do things that I enjoy. But I'm pretty sure you're all pretty much familiar with what anxiety is. So anyways, those are things that I suffer from and cope with on a day-to-day basis, and my videos from here on out will be more specific about different problems that I face in relationships and parenting and coping and therapy and medication and just all the crazy stuff in my head that I'm going to share with the whole wide world. But thanks for listening, and I hope you guys tune back in and watch my next videos. I really, really hope this reaches somebody out there, anybody out there who knows what it's like in my head. But till then,